Well, I'm just I don't know. I guess I had the idea for this thing, and so that's kind of how it happened. I'm Courtney Kruger. I'm pastor of First Cumberland in Chattanooga, and I am also the chair of the Tennessee Georgia Presbytery's Board of Christian Education. And our board, about a year ago, we had a meeting just like this with Rae for her to help us know what to do. And now we're doing another follow-up, and if we have to down the road, we might do another one, but it did seem appropriate that we go ahead and do another one now. Well, I want to introduce my wonderful friend, and she has just been so indispensable to me during all of this. She probably can't stand it when she sees my text pop up on her phone or an email come to her. So Rae wears so many hats and does so many things so wonderfully. I will give you a little bit, and she may want to say a little bit more. But she is the Chief Executive Officer of the Hamilton County Medical Association. And she also is the chair and this is Hamilton County, Tennessee, for those of you who are not from Tennessee, maybe, the chair of the joint COVID task force that is both Hamilton County and Chattanooga. But she's not only in the medical field, she also has a foot in the Cumberland Presbyterian Church world as well. She is the pianist at the Charleston Cumberland Presbyterian Church, and that handsome young feller sitting right next to her is the pastor, who also happens, and his name is Bill, and he also happens to be her husband. And so she is the perfect person to help us with this, because she both knows her stuff on the medical side, but also on the church side. And so, Rae, anything else you want to say about you and yourself before we move on?
Well, in just a moment, I'll have a couple disclaimers. So let me screen share.
Okay.
And I don't want you to be scared. I have some slides just with some CDC information, a couple things of local data, answering a couple of the questions Courtney sent. And so I may even just skip some of them completely. We'll see how the Spirit leads. Let me see what I can get up here. Let me see here. There we go. So Courtney shared who I am. So as we welcome you, my disclaimer is Rae Bond is not a medical professional or a scientist. Rae Bond is an English major, a minister's wife, and a church pianist. But I have been working in public health issues for more than 20 years, and in COVID pretty intensely for the last year. I've been leading a joint city-county task force on COVID for Chattanooga and Hamilton County. I have Bill sitting with me because he is not only a minister, he's a science nerd who loves epidemiology. And actually, with all the doctors and scientists I'm surrounded by, he was the first person to mention this weird virus that was appearing in other parts of the world before I'd heard about it any place. We became Cumberland Presbyterians because we really believe in mutual submission to the body. And as Christians, I choose to do everything I can to protect other people. And Courtney said earlier that it's sad that this has become politicized, because viruses are equal opportunity killers and equal opportunity afflictions. And I have tried in my work with the government and my work with physicians and with our church members to think about what I need to do to protect those that I love. So that's my political perspective, such as it is. So I pulled randomly some states that might be on this call. This is data from yesterday. And this is just a quick look at the number of cases of COVID and the number of deaths. And I feel, because I work with physicians and I work with state government a fair amount, I think that the death count over time, we're going to find is really much, much higher, because every state has different reporting systems for deaths. Once in a while, we won't have a death reported in our county, and then we'll have 6 at one time. And that doesn't mean that there were 6 deaths yesterday. It means that 6 death certificates finally made it way through the system. And especially in the first few months, I think that a lot of reporting cases were really underreported. So that's just a perspective on the toll, just in a few states that might have representatives on this call. So where we are today with COVID, cases are declining from the peak levels, but in our region, the decline's starting to level off. We've kind of plateaued, and all of Tennessee's actually plateaued. That concerns me. COVID in its original form is really highly contagious. And some of the mutations that are starting to appear in different parts of the country are even more contagious, at least 40% more contagious than the original strain. There are a lot of challenges in testing various strains. It requires different kind of equipment and a different methodology. So we won't always quickly necessarily know when those more contagious strains come into our community. As I said a minute ago, COVID has become a political issue rather than a public health issue. Many people are not convinced it's real, or not convinced that it's as serious as I personally believe it to be. And this presents a lot of challenges, both to people in public health, to medical professionals, and certainly to the church and church leaders who I've devoted much of my life over the last 42 years, almost 43 years that we've been serving churches together. And ultimately, as we can talk about data, but ultimately, what happens next is going to be a series of deeply personal decisions by each individual person. Everybody in the congregation is going to need to make their own decision about how much risk they're willing to take and how much trust they have in their fellow church members following safety protocols. I have 14 people who work in my office, work for me. One is not going to get vaccinated no matter what. She doesn't believe in vaccination. Another person who has been vaccinated still has been going out to dinner a lot and hanging out with groups of people. And my behavior and my interaction with them as people work for me is very different than it is for the interaction with people that have both been vaccinated, because we're in healthcare and that's been able to happen, and people that I know are taking every safety precaution. And I think to some extent, you're going to see some of that within the church. And, church elders are going to have to decide whether to enforce their decisions or just make recommendations and hope for the best. And I hope that we will all bear on the side of grace, and that we're going to all be able to not let ourselves get pulled into political discussions, and to try to stick to what public health says. And I'm going to try to share a little bit about that. So the CDC is a source of very good information. They have deeply detailed fact sheets and guidelines on almost every circumstance you can imagine. And they're updated constantly. So if you pull down some guidelines for daycares 3 weeks ago, you should check every week, because the guidelines, as more science becomes available, as people learn more about the trends and what's happening in your community, all that stuff gets changed very often. So what I say today might be different tomorrow in any number of circumstances. And that's been the case throughout this last year. We had the first diagnosed case in Chattanooga 1 year ago this week. And a lot's happened since then. So on the CDC guidelines for faith communities, the first sentence says, COVID-19 cases are extremely high. Avoid events and gatherings. And I want to say that up front. Yeah.
To give you a sense of perspective, last August, most of us were not considering opening our churches. And our incredibly wonderful decline to a plateau, we're plateaued about where we were last August in terms of how many cases are becoming active every day.
And we're still seeing that cases, and in public health, we kind of look at several things. We look at the number of diagnosed cases. The number of positive cases is decreasing, because as public health is shifting energy and personnel to do vaccination, less testing is happening. And that's a bit of a concern. We look at hospitalizations, we look at deaths. And so all of those things are factors. So the CD still recommends, not specifically for churches, but regarding groups, that people not gather with people who do not live with you. And I think when we do begin to hold services, whether that's Sunday or in September, it's really important to think about the ways we can keep everybody safe. And that is the most important thing. When I said it a minute ago, that every person's going to have to make a personal decision about how much risk they're willing to take. And that's deeply personal. I am doing a million Zoom meetings, but I have an autoimmune disorder. And in December, I was diagnosed with lymphoma. I just finished a round of treatment for lymphoma. You know, I'm kind of, it's amazing. I'm upright, really. And, you know, so I've had to be more protective of myself. And, you know, Bill talks about everything on our services, which are now on Facebook. So I just, you know, I tell people what's going on with me. But, you know, different people, and people may not be comfortable talking about that. Some people are afraid to be vaccinated or just don't believe in it. They may not share that information with you. So this creates, I think, a unique and challenging situation for churches. So, the safety steps have been basically the same since we got started. Wearing masks that completely covers your face and nose is the single most important thing to do. Staying a few feet away from other people who don't live with you. So your whole family could sit in the row in a pew, you know, avoiding big crowds. And that means being right next to each other. People need to stay home when they're sick. You know, there's always that one saint who's never missed a Sunday in 50 years. And just because she has viral pneumonia, she may not let that slow her down this Sunday. And in the case of COVID, that could be a really poor decision. So, you know, and I'm encouraging everybody I see to get vaccinated as soon as that's available to you. And later, if anybody has questions about vaccine, I will try to answer those. But the same safety protocols are still in place. And I'm sure everybody's memorized them by now. And I, you know, pretty much every week, or a couple of times every week, are on TV telling people to do this. And I'm sure they're tired of it, but it's still the best approach. So how do we know these measures work? So there are really clear correlations between doing these things and a decrease in the presence of COVID. This year, for instance, we had a really, really light flu season. And medical experts tell me that that's because people were wearing masks, washing their hands, keeping their distance, and avoiding crowds. COVID, but we still have COVID cases. COVID is much more highly contagious than flu. And unlike flu, you know, if you're coming down with flu, you usually know it and it's ready to take you out and you stay home. COVID, people can have COVID and be contagious, and before they even have a symptom, they can be contagious and never have a symptom. And that's one of the things that's been really, really scary about COVID. So, but the fact that we had such a light flu season, to me, is just a really good example of what happens when we do. And frankly, we all should be washing our hands more anyway. So there you have it. So when you're looking at promoting social distancing, you know, I think we're going to probably provide physical guides. We'll get painter's tape that's removable and, you know, mark distances within the congregation. And we'll have to start at the front because we need to be sure there's a healthy, more than 6 feet, much more than 6 feet between Bill, where he's going to be preaching, if he preaches without a mask.
18 feet.
18 feet at least. So you need more distance, because when you're speaking without a mask, any germ virus that you may carry can project further. And that's just the nature of public speaking. You all do that, so you know that. And singing projects it even further. One of the great joys of my life is music. And I so miss singing with our little choir or singing in small groups. But singing projects the virus even further. So, you know, as you're thinking about social distancing and that 6 foot marker is a really helpful thing as you think about how you might be able to worship in your facility. And that'll vary for each facility. So measuring them off, trying to, limit the size of gatherings to the extent possible, having family units sit together, all that kind of stuff can really make a big difference. You can do things like temporarily, I'm sorry, I'm so froggy. You can try to temporarily limit the stuff that you share that people touch. So for instance, we've been mailing the bulletin to everybody midweek. So they have it for their worship from home on Facebook. But we may continue to do that and help people will bring their bulletins with them, so we don't have as much sharing. So, thinking about, can you have a collection box in a stationary location that people can drop their offering in?
And can I make a point here?
Yeah.
About 30 years ago, we tried an experiment in our church in Maryland. We quit taking up the offering. We had plates at the doors, and we discovered giving went up. We're not sure why. So be aware that sometimes new things can work.
Yeah. And so, things like that. So for communion, we did parking lot communion, but we have little pre-done cups that with both of the elements together. The thing that will kill me the most is, we have this precious couple in our church, Jimmy. Well, we have lots of precious couple, but I'm just dying to hug Jimmy's neck. I'm dying to hug Jimmy's neck, and I'm gonna have to not do that. If food is offered, try to see if you can do pre-packaged options, or if you're going to have a buffet, have somebody serve the item so multiple people aren't using the same serving pieces. Because otherwise, you know about church buffets. They call us evangelicals for a reason. Nursery, there are a lot of guidelines on COVID. In the last couple of days, I saw some articles indicating that they're looking at, in school settings, which would apply to church kids in church, that they're looking at whether they can narrow the distance required between children to 3 feet instead of 6 feet. And I think you're going to see that pretty soon. But figuring out how to keep the little critters separated and wearing masks. Our grandson is almost 4. He's getting very big, and he goes to preschool. And they sent us a video the other day. All the children, the 4-year-olds, are all wearing their masks and washing their hands a lot. He's a champion hand washer, so I know it can be done. I can't imagine doing it myself, but I know they can. So masks are just really important. And masks, people think about the mask as offering protection for me, because it's really all about me. But really, the mask is the way that I protect people I care about. So if I have, one of those unfortunate people who was exposed to COVID and don't know it, I'm not going to share it with you. So it does provide some protection for the user, but it really is an act of sacrificial love to mask up to protect those around you.
Can I interrupt 1 second? If you have been vaccinated, you can still get COVID.
Yes.
It would only be, if you got one of the better ones, it would only be 5% as bad as it would have been if you had no vaccine. So if you're vaccinated, you can still have COVID. Mm-hmm. You can still share COVID. And in early December, the British variant, as they call it, was 2% of the cases in England. It's now almost 99%. So yeah. The new variants are going to be around. So just because we're vaccinated doesn't mean we're totally free and clear. It just means we're on a really good path.
Yep. We're just full of good news tonight. So back to masks, if a speaker or individual speaker singer is participating, yes, as we said a minute ago, be sure to add at least 18 feet between them and the first row of people. So that'll be about the 3rd or 4th row in our little sanctuary. If the congregation wants to sing, I would insist that they wear masks. And I know you can't really insist anybody does anything, but I would strongly urge them to wear masks. At this moment, I don't recommend group singing in which vocalists cannot be socially distanced. Early in this situation, there was a choir, I think maybe in Texas.
That was in Washington.
Oh, in Washington State, that a small choir that somebody came with COVID, and it pretty much wiped out the choir, including a bunch of deaths. So having people behind each other in rows singing is at choir practice, it's just a bad idea. So, and that makes me really sad. You know, everybody knows what the symptoms are. We need to figure out and just push people and urge people to stay home. It's just very important. The CDC and state and local health departments all have signs. You can download them and print them, reminding people to wash their hands, you know, so communicating with your members. And this is really important. I would check your state and local health department websites very often. In most areas, they're doing a really good job of keeping updated numbers, like on the number of cases. There's a scale of what zone you're in, and which includes how protective people need to be. So the numbers are different, vastly different in different states, and there are people from many states on this. So please check with your state and local health departments. And the CDC also has some good maps that show overall trends. And if somebody is diagnosed with COVID and is determined to have been in your building, you know, you really will need to have people depart and really do thorough cleaning. If you just have one service on Sunday and nobody's going to be back in the building until next week, that's a different matter, because the virus does not actually last that long. So this was an interesting data. I just got this yesterday, and I don't know that it's been publicly released, so I probably shouldn't be putting it on Facebook, but well, anyway. The Hamilton County schools, and the reason I'm actually showing you this is the number of COVID cases that have been tracked in Hamilton County schools, in our public school system. And if you notice, the numbers with one little tiny blip right there with the 8th graders, don't know what's happening with them. The numbers of positive cases increased significantly as kids get older. So obviously, we always think of toddlers as being disease vectors. It's really the teenagers. So I just thought that was really interesting as you're looking at Christian education. Hopefully, it will be a little easier to get the older kids to understand the seriousness of all this stuff. So this is a chart from the Tennessee Department of Health, and something like this is on pretty much every state website. So today, this is from March 8th. So today, our county opened vaccination allocation up to 55-year-olds. It's also open to anybody 16 and over who's got any kind of comorbidity or, you know, on health issues. So as you can see, you know, we're moving pretty quickly in some areas. Interestingly, in Tennessee, apparently the pace of vaccine is going much faster in Eastern Tennessee than it is in Western Tennessee. And most health departments are posting immediately when they have vaccine available. Most places have set up great drive-through facilities, so you have very limited contact with other people when you're getting vaccinated. Bill and I have both been vaccinated. We are very thankful for that. And I think my chances are better to not have COVID and have the vaccine than they were to try to deal with COVID. So anyway, you'll see something like this in your own states and communities, counties, that'll give you an idea of exactly where you are. And so one challenge is that older people who may be at more risk are the first people to be vaccinated, and those in first responders in healthcare. So, you know, to some extent, if you're confident that everybody or most people in your church has been vaccinated, that's a really important indicator. And I would encourage people to be very transparent. There are people who can't be vaccinated. There are people who have allergies and who can't be vaccinated. And so I think it's really important that we deal with folks who are unable to be vaccinated with the same kind of love we want that the Lord commands us to do. And I just hope people will be transparent and upfront about what they've done or not done, so people can make individual decisions. Tough questions to consider. So if you decide to have congregational singing, if people wear masks, how will you handle it if a member refuses to wear a mask? Will you decide to avoid singing completely? Singing does project the virus 18 to 25 feet. And after being projected, the virus will hang in the air for 20 to 40 minutes. I didn't make that up, that's science. If some members have said they will refuse to wear a mask, do you need to do, we've always joked about having the clapping and no clapping sections in the church. Do you need to have a service, for masked and unmasked, with the unmasked service being second, because you'll have more cleaning to do after that service than you'll have after the service where everybody's wearing a mask. When can we resume Sunday school or Bible studies in smallish classrooms? Can you consider holding a class in the sanctuary or fellowship hall so people can still spread out? If everybody in a class has been vaccinated and wears masks and keeps a reasonable distance, it should be okay to have Sunday school. But you need to be confident that everybody's going to do that. For herd immunity, and I really hate that word, makes me want to moo or something. But anyway, for herd immunity, we really need about 80 to 85% of a vaccination rate, and we are a long, long, long way from that. So the pace of vaccinations getting much faster. And as the weather gets better, outdoor activities for kids are really great alternative if classrooms are small.
And I just thought of a tough question while Rae was talking earlier. If we mark off our sanctuary so we know how many people, where people can sit, does that mean we know how many people come in and we start limiting who can come in? In other words, we have someone with a counter and say, I'm sorry, we're now full.
Most churches in America would long for a problem where they had to.
When we first start, particularly if we start at Easter,
Yeah,
I could
we'll
see
have
that
people.
That could be
Yep.
a mass event. Yeah.
Yep, I don't have an answer to that. So, but what about vaccination? As I said, Bill and I were thrilled and relieved and grateful to be vaccinated. Initially because of our work. Now we could be it because we're old and because I have health conditions. All the medical professionals that I honor the most, especially the infectious disease specialists, pulmonologists, cardiologists, and internal medicine specialists, have happily been vaccinated. There is a palpable sense of relief in the whole medical community as vaccination has been able to roll out. I understand the concerns that people have, but I also deeply understand how severe and serious COVID is. We've lost people we love to COVID. We've seen physicians and hospital staff absolutely agonize over what they've seen in hospitals as they've treated these patients. So I'm encouraging everybody I love to get vaccinated as soon as they can. And everybody else. Even if I don't love you, I still want you to get vaccinated. And I love you as brothers and sisters in Christ. And also, so getting vaccinated is step one, following the safety protocols is kind of step two. It's important. And I've had to tell my staff, just because we've all been vaccinated, you still got to do all that other stuff. So I'm not always very popular at work. So a final thought, and then we can take some questions. So, because people have diverse beliefs about COVID, my prayer is that we'll be able to discuss where we're at honestly and with a desire for understanding and unity. Each individual needs to determine how much risk they're going to be willing to take, and that'll be based on their age, on any health conditions. And, there are people who look like they're perfectly fine, and they may have an autoimmune disorder. that, you know, lots of people have stuff we don't necessarily see. It's not like having a broken arm. People were shocked when I discovered I had lymphoma. I had some swelling above my eye, and that was the only physical sign. It was just bizarre, and I'm thankful we caught it. I pray, and as I've done all this work on COVID, I pray that we'll all have a spirit of submission to the needs of those who are the weakest. Sometimes we do things to protect the weakest among us and the people who have the most challenges. And sometimes those are the people who need us the most often. And that's really my prayer. I will love my friends who don't want to be vaccinated and who want to socialize during spring break. I'm just hope that they'll be honest with me about those things so I can make a good decision based on my own health issues. And, you know, every force in the universe seems determined to divide us as believers. My prayer is we won't give into that temptation and that we can move forward for the good of the fellowship in unity. So those are my thoughts. I'm going to close out. So if there are things in the chat, we can all see. I'm going to stop share and I can see your beautiful faces. So again, a few key points. Check out regularly your local data. Your health department, county and state health departments can give you an idea of what's happening specifically in your community. That can vary from county to county. In Hamilton County, we're surrounded by counties that don't have mask mandates. Our county still mandates that people in public settings wear masks. And for the whole year, with 1 or 2 days of exception, the majority of people in our hospitals are residents from those counties who don't have mask mandates. So well over half, sometimes as much as 2/3 of the people in our hospitals here in Hamilton County live in counties that didn't mandate a mask. So to me, that's just one more indication that masks really, really work. So are there questions? I see Pam.
Rae, I think that Courtney has a few pre-populated questions.
Okay, Courtney, go for it.
Yeah, he's got them. He's got a few, but if others have a few questions, go ahead and put them in the chat.
And thanks, Rae, because a lot of the questions that of course, you have them ahead of, you've already answered, I think. One question that occurred to me that is, I guess, tangential, I think very important, help us understand, if our congregation, we feel like everybody has had the opportunity to be vaccinated and the waiting period after vaccination is over, why would we need to continue to think about wearing masks?
If you've been vaccinated, you still can get COVID, but it's likely to be only 5% of what would have happened in terms of the impact of the illness on you. And while you may not personally experience very much in terms of symptoms because you've been vaccinated, you can give it to other people. And again, it's sort of like, we tell people to vaccinate children because there are some kids who have physical conditions that don't allow them to be vaccinated. So you vaccinate for yourself, but also for others. And right now, wearing a mask is still sort of the same thing. Because you can share COVID with other people, and you may not even know you have it because you'll get such a mild case because you've been vaccinated. So I think until and right now, let's see, I didn't look at the data for a couple of days. In Hamilton County, about 11% of the population has now been vaccinated in our county right here. So we have a long, long way to go. Yeah.
And if you've been vaccinated, and if the virus gets in you and you have no symptoms and it's a 5% case, so it's not bad at all, with a new variant, you will be in a position to transmit 10 times as much virus out of your breathing, out of your nose, than you were with the original strain.
So what we're looking at when we're wanting to, all of us, of course, just want it to feel like it used to be in some sense. And what we're looking for there is that I shouldn't call it magic, but the herd immunity and we realize we're a long way from that. Is that a one way of saying that?
Yes, we're a long, long way from that. As I said, in our county right now, about 11% of the people have been vaccinated. But it's the majority has been now age 60 and older, or people who have pre-existing conditions and people who work in healthcare. So that's a huge swath of the population that hasn't even had a chance to be vaccinated yet. And again, the data's, the criteria who qualifies is going to change, is going to be a little different from each county and in each state. I would say the federal government, the encouraging news is that the availability of vaccine, first of all, we have 3 different kinds now available, and one of them just requires 1 shot. And so that makes it easier to get people vaccinated. That's a big help. And the amount of vaccine and the resources being poured into getting the population vaccinated it is really extraordinary how much that's increasing. So, by September, I think, and maybe sooner than that, I think most people will have had an opportunity to be vaccinated. What we don't know, though, well, not just how many will, we don't know if you're going to need to be vaccinated every year. So that's a whole different kettle of fish. But I wish I was bringing you guys just happy news, but there is a path forward. There is hope. Things are so much better than when I talked to you before, because the healthcare professionals know so much more about how to treat this thing. We know what works. Vaccine is here and it's ramping up quickly. And I believe it's really miraculous. What we've learned in 1 year is just extraordinary. It's just extraordinary to me, the pace of medical science. So that's hopeful.
A big question, I think, is with children who I do not think are going to qualify for vaccines yet. What does that do for our timeline, for our children's ministry, that kind of thing?
I would keep watching the news over the next 2 or 3 weeks. Kids, first of all, my grandson's preschool has convinced me you really can get little people with a little bit of help to wear masks, and they seem to be doing just great. The fact that we're entering summer, I think it's going to be, it's going to be much easier. It's the virus is much less active when you're outside. So any activities you can do with kids outside would be really terrific. You have to make hand washing and mask wearing and all those things a game. I do suspect that they're going to narrow the distance that need to be between kids, and I think that can really make a huge difference. I really don't have a definitive answer on that. Kids seem to be the first child in the United States to die from COVID died actually in Chattanooga. So it can be serious, but kids seem to do better. I don't know. I wish I did.
Okay. I think that may hit. Oh, well, no, yeah, I think that hits all the questions that we had. So if others have other questions, please type them in the chat. Several people have asked if we can get copies of your PowerPoint. If you get that to Pam.
Oh, sure.
Okay, super.
Yeah, absolutely. No, I'd be glad to do that.
Watch your emails, folks, and I'll send it to you tomorrow or whenever Rae gets it to me. I did have a couple of questions, Rae. One of the questions was mine. Do you happen to know where we are as a country with herd immunity, even though you don't like that word, moo? Do you know,
Well,
is your county typical? We're about 11%.
We're above.
I think we're actually a little bit above
Oh, sad.
vaccination. Yeah, yeah. And it's really, it's really sad. It's really sad because we really can't, we can do better. We need to do better.
I have another question that has come up
Yep.
in several settings that I've been in when we've been talking about this. Is it appropriate or inappropriate to ask for a vaccination card, to ask people, have you been vaccinated? To me, that seems like an invasion of privacy, and there are HIPAA laws about that. But give us some feedback on what, as church leaders, we can ask or not ask.
HIPAA, and I do this as an employer, because there are things I can ask and things I can't ask. The way I would approach this is that we have members, we have friends and members who have health risks, and that we encourage people to be loving and to be transparent and be honest with our fellow congregants, so that if you choose not to be vaccinated, it's just like my employee. I just told her, I said, look, if you're in my office, even for a minute, don't take your mask off. We're going to be very strict on these protocols. It's your choice. If you don't get vaccinated, I can't make you get vaccinated. And and I thanked her for being honest with me about it. And I just think we need to try to promote transparency, but transparency is only going to happen if our transparency is not accompanied by judgment. Right. We can't make people bad examples. We can't make them pariahs. What would Jesus do is pretty much my baseline every day. In everything I try to do, and he's not going to shame people, and I just hope that people will be loving enough, or if they know that they're doing risky things, that they will self-isolate themselves to avoid sharing.
So let me push you just a little bit further with this question, because we have a bunch of camp leaders here in addition to pastors.
Yeah.
Is it appropriate? Would it be appropriate? What is the sticky wicket of on your registration form for church leaders saying, I have been vaccinated, I have not been vaccinated? Because I think it's appropriate. Yeah.
Well, I think it's appropriate to add, I personally think it is appropriate to say, will you be willing to share with me, have you been vaccinated? Because that helps us know where we can station you.
Right.
How we can help you find your paths of service in a way that's protective of you. Yeah. And there may be some things we as a loving congregation won't ask you to do if you've either chosen or if you can't be vaccinated. Mm-hmm. And so to me, but it's going to be really important to try to tone down. It's just important to be cautious with the rhetoric,
right?
As we deal with people, because the last thing we want is to sow more division. We're trying to protect people here, and we're trying to be able to get back together and share fellowship and share the love of Christ. And it's a delicate balance. I mean, I've had people who called in my office and who cussed me out because I was on TV telling them to wear their mask. And I'm just like, I'm so sorry you feel that way. I just want, our community to be safe. God bless you. Have a nice day.
So I think what I've heard you say is, even if every single person in your congregation is vaccinated, you still need to practice the safe protocol, because COVID does not always show symptoms, and even a vaccinated person can carry the virus to a more medically fragile person or a non-vaccinated person. That's
You
what
did
I'm hearing
so
you
well.
say. Okay.
That is exactly what I'm saying. And because you're vaccinated, you may have fewer symptoms. You may be less likely to show a symptom because you have been vaccinated. You'll have a milder case, but it can be just as virulent as somebody who has health risks and who hasn't been able to be vaccinated. And there are legitimate reasons people can't be vaccinated.
You're not bulletproof.
You're not bulletproof, yeah. So
Well, that right there was a very helpful insight, at least to me. Thank you.
yeah.
It's a depressing insight,
Yep.
But
Yep.
and did I hear you say that we can't return to normal, whatever that is, until we reach herd immunity? Okay, so that's the magic right there. Okay,
that's the magic. Yep, that's a magic. And I really do feel encouraged. I don't want to be Debbie Downer here. I do feel encouraged by the increasing pace, the cadence that we're getting for vaccination, and the increased availability of supplies and testing. And the most encouraging thing to me is just the rapid increase in knowledge for our healthcare providers, and science has been an amazing. To me, that's the greatest miracle that the Lord has worked, is the wisdom and the insight that's been provided to help doctors know how to treat COVID patients, and has helped the pace of science find these things. And I just think that the Lord gives us intellect, and he gives us the tools. And I think there are a lot of people who have been working sacrificially to help us get to this point. So that's such better news than the last time I talked to many of you.
A year ago this week, the general expectation among experts is that we could not even begin to ship vaccines until the fall of 2021.
Yeah.
So between AI and research, what has happened is so unprecedented that it's breathtaking even for experts. God has been very good.
And, you know, a lot of people, I encourage you all to read a little bit about vaccination. A lot of people say, oh, it happened too fast, I don't trust it. But in fact, there have been research that's been happening that provided the underpinning to develop this vaccine. And the thing that's made all the difference, there normally are sequential processes in vaccine development. So there's the research and the evaluation and the safety testing process. And when it gets through all of that, then they start working on manufacturing. So what happened in this case, the federal government basically provided underwriting. So at the same time that the best candidates to develop vaccine, at the same time that science was happening, they were building the whole manufacturing capacity. Okay.
And this week, a year ago, was the first test done on a vaccine even before it was presented to the federal government, within 7 weeks of the beginning process, because they've been working over 20 years on this computer model. They were able to create something, and no one, even they were a little surprised at how quickly they could make it work.
Yeah.
There is
Yep. I'm sorry. You won't, were you going to do the chat, Pam?
Yeah, I was just going to say there are a couple of more questions that we'll see if you can address, and then we've been here for an hour, and it might be time for us to wind down. But one of the questions Jen Newell asked is there a commonly accepted threshold for community spread or case numbers that would indicate we could loosen up a little bit?
We, in our area, because I know where Jen's church is, in our area, we're still
August levels.
We're still at the levels from last August. We're not there yet. I mean, we're not there yet. And I'm, maybe by the federal government saying that it's possible that we can start by the end of summer, get most people have access to vaccine. And so to me, that's like a miracle. But we're still some months, I think, away from that. Yeah.
Thank you. Nate Matthews from Lubbock, Texas, says also, by only thinking of our people, we automatically limit the possibility faith for guests. So he asked that as a question, but maybe you want to reflect on that a little bit for us.
I think that if all of our people are understanding and have the right spirit, and if there's a heart of love that offers them a mask when they pop in the door, and if we can make these things matter of fact, that this is a season and this is what we're doing for this season, and we're doing it to protect each other, and because we love you as a guest, we're so glad you're here. May we ask you to wear a mask. I think so much, as I've watched so many different people try to figure out how to deal with this in different settings, in politics and healthcare. I think the spirit and the heart with which we approach people makes all the difference in the world. If we approach people with accusation and judgment, then we're doomed. If we approach people with love and a welcoming spirit and don't make a big deal of it, and if everybody's trying to help support it, I think that makes all of the difference in the world. And the bottom line is, if everybody in the church, if everybody in our sweet little church, if they're all wearing their masks and washing their hands and social distancing, if we have a couple recalcitrant guests, probably they're still going to be okay because they're doing all the right stuff. That's the way we protect each other and protect ourselves.
In my work as a hospice chaplain, I have been closer than 6 feet to COVID patients, but in full PPE. I've gone into homes where people have not been honest about whether or not they had COVID symptoms because they wanted to keep getting services. But by following these the basic, wear a mask, keep your distance, wash your hands. I have not, as far as I know, gotten COVID. And while we have had some workers who gotten it, that's been true in a lot of health situations. So, but I mean, seriously, I have been in many places where if you'd asked me a year ago, I said, no, I won't do that. If you're careful, it's amazing what we can do together on this. And I think Rae said something very important anyway. Everything we should do would be bathed in grace and a desire to enter into a relationship instead of coming up with a bunch of standards that we impose.
Yep.
Okay.
You guys are very gracious to just sit here and listen to me. Nate. Yeah, if we loosen up, then we could put our guests at risk as well. Yeah, I just think until we get way down the road, guys, I have masks every place, and I hate them. They make my glasses fog up. But I do it because I love people around me.
And to show how you changed, the other night I got home from work, I got out of my car, I started to go into the door, and first of all, I put on my mask without thinking I'm going home. So.
Yep, different world for all of us. Well, I think as Pam said, it's probably a good time for us to kind of Pam's gonna mention this and say I was gonna ask you to do that. But I think it's time for us to close down, but we do want to first thank Rae and Bill so much. And I also want to thank Pam and Christy who have put all this together for us. Thank you. The Board of Christian Education, Tennessee, Georgia Presbyterian did an event for pastors, a Zoom event for pastors and a Zoom event for elders. And the elders liked it so much, they asked for another one. And we decided to make that denomination wide. And so Pam, you want to talk about that just for a moment?
Just a little bit. Christy, can you access the meeting since it's in the MMT Zoom account? And can you copy it? If not, I will post the Zoom link in the email I send you all tomorrow with Rae's PowerPoint. How about if we do it that way?
Sounds good.
Okay, and it is just a time for elders to gather and without their pastors, and they can talk freely and share freely with each other and share what this past year has been like and how they have served and how they would serve going forward, and mainly just a time of support and gathering information from each other. So we're going to do that on April 6th. Oh, there it is. There's the link. And I will also include that again. I'll include that in the email that I'm going to send out to you all tomorrow with the PowerPoint. And so share it with your churches and your elders and within your presbytery. You will register, click on that link, and that link will ask you to register for that event. So this time it was a two-step process, and we continue to learn as we do these things. So this is a Zoom registration for that meeting. Thank you.
Okay. Well,
And I'm going to send the PowerPoint. If it's too big, Pam, later I will put it in a Dropbox. I'm hopeful that it'll go through, but it will depend on your limitations. Yeah.
Okay. Thank you.
I'll send that shortly. Thanks.
Thanks.
so I'd like, for us to close, I'd like to ask my pastor friend and science nerd, Bill Bond, would you be willing to close us in prayer this evening?
Lord God, I am so grateful for the many ways you show grace and the way you get ahead of us. The idea that people are developing this vaccine before we really knew we needed it just shows how you continue to step ahead of us and take care of us. But I particularly pray now, Holy Spirit, for a blessing on each one of these leaders. We are pouring our hearts out for our people. We want to protect them, and we also want to have the chance to get together. When we worship together, we are stronger. And when we serve together, you are more evident. So we pray for wisdom to know the right thing to protect our individual members and do the right thing to protect our communities. If you don't lead us, we're just going to stumble around. We need your wisdom, and we need the confidence of your presence. Keep us all safe as well. I pray this in Christ's name. Amen.